Dear ladies, dear viewers, have you been told that if you have endometriosis, you can't have children? Don't believe this statement. This is not entirely true. Yes, there is a strong link between endometriosis and infertility, but it's not a situation without a solution. On the contrary, it's a process we can overcome with the right steps. Unfortunately, endometriosis is seen in about 10 to 15% of women of reproductive age, so it's very common. About half of these patients, nearly 30 to 50%, experience infertility issues. That's also common. In this disease, the uterine lining is found outside, either somewhere on the ovary or in any area inside the abdomen, causing adhesions and secreting various substances. This not only alters the quality of the oocyte and disrupts implantation, but also, through adhesions, especially prevents the tube from picking up the egg, thus creating a situation of infertility. So it's a complex and complicated condition. That's why there is no standard solution for such a complex situation. Every patient is unique and there should be a personalized approach for each one. In our clinic, we create a special roadmap based on scientific data for patients who come to us with endometriosis and infertility issues. In particular, we first conduct a detailed assessment: age, stage of the disease, egg reserve, and previous treatment history. These are very important. What do the scientific data say? Especially in cases over the age of 35, most centers and clinics around the world direct patients to IVF to avoid wasting time. If you have complaints of pain or if surgical treatment is being planned for the first time, endometriosis lesions are removed with laparoscopic surgery. Afterwards, we plan the most appropriate treatment. These surgeries both reduce pain and can increase the chances of pregnancy. However, if the patient has already had surgery before and does not have any pain complaints, we do not want to refer them for surgery again, because there is no definitive evidence that repeated surgeries increase fertility and they bring unnecessary risks. In such cases, we may prefer more effective methods like IVF directly. For our patients who only have infertility and no pain, we can consider IVF treatment directly. We take this into consideration. Avoiding unnecessary surgery may be the best way to preserve fertility. In endometriosis, the most critical step for successful results is a personalized approach. We will make the decision together based on your situation. If you have any questions about this or would like to get a consultation, you can contact us via the WhatsApp link in the profile. Don't postpone your health. Let's move forward on this journey with the right steps, in the right way, on the right path.